Hi, everyone. My name is Pamela Manning, and I'm a board certified nurse practitioner. And today I'm going to go over the kidney, but I'm going to do it in three parts. This is just going to be the basics of the kidney, which I do believe that to be successful on the board, the State Board of Nursing, you need to understand the normal function of the kidney or the organs, because once you know the norm, then you will find that you're more likely to spot the abnormal. If what I'm doing or helping you with does help you, please subscribe to the channel, share it with your friends, and also comment. Let me know if there's a topic that you would like for me to cover for you. Okay? All right, so let's start with some of the normal function of the kidney. Filtration and excretion of waste. Most of you guys already know that, right? It removes dirty stuff. It's like your pipe. It get rid of your waste of your body. But it also regulate electrolytes and acid. It causes a balance in your body with acids and which acid base. So we're gonna go through that in a little bit. But it also does something else. It stimulates the production of red blood cell, which is called erythropoietin. This is something that's very important because your red blood cells help to carry oxygen throughout your body. So if it's not enough red blood cells in your body, which is a kidney help to produce this, then you're going to have people who is hypoxic, is lacking oxygen, right? It also regulates your blood pressure. Guys, regulate your blood pressure. So therefore, if a patient has a lot of fluids in their body, their blood pressure is going to go up. If they have too little fluids in their body, it's going to go down. And we know it regulates fluid reabsorption in the loop of Henle in the kidney, guys, which where does Lasix work? In the loop, right? Lasix help is like your water pill in the loop of Henle, guys. This is something that's big that you need to know. All right, so let's talk about something that I talked about previously. On all your patients, you want to know them. You want to know who you're taking care of. You want to know their diagnosis. You want to know their history and their physical. Get a baseline. If you don't know what the baseline when your patient came in, how are you going to know if they're improving or getting worse? You need to know this. You want to keep abreast that you follow the rights of medication administration and always utilize your nursing process, which is ADPI, right? Assess, diagnose, plan, implementation, evaluation, and always ask for help. So right now I'm going to go through the little basics of electrolyte and acid base balance. I'm not going to break down the electrolytes because the electrolyte takes forever right now. I'm just going to go through and talk about the acid-base balance. So let's talk about pH. That's one of the first thing you want to know, the pH. What in the world do I mean when I say the pH, right? It represents the hydrogen ion. This right here, hydrogen ion, which is the buffer process, right? There's three things in your body helps to regulate this. It's the respiratory system, it's also the kidney and the buffer mechanism. But what happens when you're talking about the pH, guys? Any of you know what happened when we're talking about the pH? Hydrogen ion is released or absorbed to regulate the acid-base balance. That is what happening when we're talking about the pH of 7.35 to 7.45. If you look to the left of 7.35, anything over here, if it goes down, it becomes more acidic. And if it goes up over here on the right, 7.45, it becomes more alkalosis, right? It become alkaline. Your body norm is 7.35 to 7.45. And this is your hydrogen ion that helps to regulate the pH. But then you have the respiratory system because you need all three of this to make it balance in your body. So the respiratory system, what does that do? it excretes CO2 and water, carbon dioxide and water. So it increase when you have increased respiration, it causes the removal of CO2 from way down in the alveoli, and that make it less carbonic acid. But when you have decreased respiration, it keeps the CO2 in your blood, and that causes more carbonic acid. So again, when you have increased respiration, it causes less carbonic acid. When you have decreased respiration, it causes more carbonic acid because you absorb more carbon dioxide. All right, so now let's talk about the renal system. HCO3, that's bicarb, bicarbonic acid. What the kidney do? It remove urine, right? But the urine is very acidic. What number would that be? Somewhere lower than 7.35, correct? So the kidney help to get rid of that acidic waste out your body. Imagine if you have some car fluid, you know, the fluids in your car, that nasty strong battery fluids is very acidic, right? So let's use that for the kidney. Imagine if you cannot get that out your body, what it's going to do to your electrolytes, to all of the fluids, everything is going to become very acidic, right? Because you can't get rid of the junk in the kidney. So we need the kidney to function so that it could remove waste. This is the reason why people have to go through dialysis, because if it stays in, it can really kill you. Because if you have too high of a pH, it could kill you. If you have too low of a pH, it could kill you. So either way, it can cause you to die, right? So respiratory acidosis or alkalosis, what that is excess hydrogen ion. Remember over here we said the buffer of hydrogen ion? So when you have too much hydrogen ion or too little hydrogen ion. So alkalosis and acidosis. When you have metabolic acidosis and alkalosis, what does that mean? You have excess, well, this shouldn't say hydrogen, it's supposed to say HCO3. So excess HCO3, so that's excess bicarb or decreased bicarb, okay? So just keep that in mind. When you're dealing with metabolic, you're talking about the renal system. Metabolic could be acidosis or alkalosis, and that's excess HCO3, excess CO3, and that's called bicarb or decreased bicarb. So this right here should have a CO3, just like this right here. The renal system deal with metabolic. Keep that in mind, guys, because when we move on, it's gonna make more sense to you, because this is just a basic slide, and then we're gonna create another 2 slides. One that I'm gonna show you how to spot when it's metabolic respiratory or alkalosis acidosis, for either one of those, okay? So right now we were just talking more about the pH and let you know when to think the buffer system or hydrogen ion, whether to think respiratory system or bicarb. So remember, pH is a buffer, which is a hydrogen ion, and with the hydrogen ion, it's like it just keep decreasing and reabsorbing to balance it out. And then with the respiratory system is CO2. Either they're gonna be breathing fast with respiration increasing, and or they're gonna breathe slow with their respiration, right, causing more carbonic acid in their blood. So it's either decreased respiration for the respiratory system or increased respiration for the respiratory system. When it's increased, you have less carbonic acid. When it's decreased, you have more carbonic acid. And with the metabolic system, which is the renal bicarb HCO3 bicarbonic acid, just remember that's the kidney removing urine, which is very acidic, and this is gonna affect like electrolytes and stuff. Okay, all right. So guys, if what I just went over helped you at all, please subscribe to the channel, share it with your friends, and comment and let me know what other topic you would like to know about, because I'm just starting this channel and I'm gonna go on and I'm gonna make these short clippings just to try to express some more of these content that I know for sure that can help you with your board. Because from working with lots of students, I get to realize that a lot of it is just the comprehension, that you not really understand what they're talking about. And trust me, we've been there. So we kind of understand this process. We understand that it's a hard concept. Nursing is like a foreign language. So guys, subscribe, share it, and comment and let me know what other topic I could bring for you, okay? Thank you. And this is Travel and Grow with Dr. Pam. Travel and Grow with Dr. Pam, where I cover multitude of topic, not just Nclex, but I covered a lot of stuff. Yes, we do group tours, travel to Dubai and all over the world. We also help nurse practitioners and nurses to start their own business. And I also mentor different nurses and students and women. So guys, subscribe, share, and comment. Thank you and have a wonderful day.